right, so we're going to take this dressing off. So this particular patient had a basal cell carcinoma excised by Dr. Saradet via Mohs surgery to remove this skin cancer. Now, interestingly, this wound was left to heal open, as you can tell. So we didn't put stitches in it. We didn't put stitches in it because, as you can appreciate, that skin is rock hard and unmovable. And so how are you going to pinch that together and put stitches in it? You can't. So we let the wound heal in from the bottom up. And then as that wound fills in from the bottom, the skin edges will close in all directions. And so he had surgery yesterday. So we're just going to get kind of this junk out of his wound. This is just a special product sometimes we put in wounds to help with post-surgical bleeding. And we just like to bring it out of the wound. And so I'm just cleaning it with a Q-tip, just like you would with your wound care. And so the instructions are the day after surgery, after 24 hours, you take your dressing off and you do your wound care. You wash with soap and water, you do all that stuff. So let's go on a journey together. You just had surgery and you got to start your wound care. So you take the dressing off, reveal the wound, and then you're going to wash it with soap and water. I'm a big fan of just doing it when you're in the shower, and don't be scared of this. I mean, we're going to wash it. I'm kind of getting in that wound and I'm cleaning it. I'm not being aggressive, but I'm being assertive. I'm getting in there with purpose and I'm doing it. And so it's not unexpected to have a little bit of soreness after surgery, but you can tell I'm getting in there, I'm doing it, and the patient's not complaining. He's not yelling or kicking and screaming. So we've cleaned it. We wash it with soap and water. As far as recommendations go, we like all kinds of things. Dial is a good option because it's mild and it's antimicrobial. What I don't want you to use is the pre-surgical soap. That Hibiclens, that red soap. I don't want you to clean this wound with that every day because it's very, very good for intact skin, but it's not good for wounds. So after we wash with soap and water, we take our Q-tip, we dip it in hydrogen peroxide, and we're going to clean the base of the wound. So the base of the wound is the bottom. The base of the wound is not this peripheral skin edge. It's inside the wound. And again, I'm not being aggressive, I'm not digging, but I'm getting in here with purpose and I'm cleaning the wound. I'm getting this kind of what I call schmutz, this junk out of the wound. I'm getting the skin edges, I'm getting the bottom of the wound, and I'm just cleaning it up. Now that we've cleaned it with the soap and the water, we've cleaned it with the peroxide, the next job is to put the Vaseline in the wound. Now if you'll notice, we don't see a ton of it today, but I do expect some redness directly along these skin edges, but not extending into the peripheral tissues out in the surrounding tissue. That's when I get nervous. So when you have redness that's streaking downwards or outwards from the wound, that's when you need to call me and say, hey, I got spreading redness. Now the other thing is you can see a little bit of bleeding in there. Healthy wounds bleed. That's what they do. That tells me that the wound bed is healthy and it's doing good. But it shouldn't be bleeding out. So we're going to take some Vaseline. The trick here is to roll. You roll on the Q-tip. So you put it in the wound and you just roll and it'll stay right there. And so you'll get good at it after you do it a few times and you just kind of keep rolling and you get a nice thick layer across that entire wound bed and along the edges. That's the goal. So we're just putting it on there. Now what I don't want you to do is put a bunch of Vaseline out here in the surrounding tissue because you can actually cause damage to the surrounding skin and actually cause your wound to get worse. And so put enough Vaseline in there to fill in the wound, but not enough to overflow and hide or saturate the surrounding tissue. As far as bandaging goes, it's 1,000 ways to skin a cat. What matters is using a non-stick or non-adherent pad. So you can see how this one's shiny and it's smooth. That way it won't stick to the wound, because if you use something like gauze, that gauze, the fabric, the threads in the gauze will stick to that wound bed. And when you pull it off, it's not going to feel good, and you're going to bleed, and it's going to be a mess. So, but you can use a regular Band-Aid. When you look at the Band-Aids that you get at the store, there's a little white pad on them. It's the same thing as this. It's a non-stick pad. So you can just slap a normal Band-Aid on there. Today, he's getting a custom bandage from me. Now, of course, this needs to be secured. I got to put some sort of tape on this guy. The type of tape doesn't matter to me. I like this blue tape. It's my personal favorite. This is a sensitive skin silicone tape, and it's characteristically blue. Now, as far as taping it down, you don't have to get crazy with it. You could put one piece across this whole thing, and that would be fine. You can put a piece above and a piece below if you're worried that you're going to be particularly active and you're worried about it staying in place. I'm going to give him 2 pieces today because I like them. All right. Now, wound care should be done twice a day here in the beginning. So that's what the surgeon will tell you. That's what the medical assistants will tell you, to do it twice a day. Now, that doesn't mean that after you come and see me for additional wound checks, that your wound is doing really good and we can transition to just once a day. But at the beginning, twice a day until otherwise instructed. We leave the bandage on if we're out and about. But if you're at home relaxing, enjoying life, watching the latest, Ohio State, Michigan, just anything besides Georgia football game, you can leave it open. You can leave it open. You just take the bandage off, put some Vaseline on there, and you can leave it open while you're at home. But if you leave the house, you're going to go play tennis or golf, or you're going to go to a nice dinner on the island, you should cover it with the Vaseline and the bandage. It's also recommended to wear the bandage at night. That serves medical purposes in the sense that we don't want bacteria from your bedding to get in the wound. But also, your partner might kill you if you get blood all over the sheets. That's your wound care. It's pretty straightforward. Wash it with soap and water, clean it with hydrogen peroxide on a Q-tip, Vaseline, and a bandage. That's the ABCs of wound care. We made these instructions because they work and these wounds heal. So if you follow our instructions, you'll do just fine. All right, thanks for coming and seeing me. You're doing a lovely job. Keep it up.